Welcome back to Tuesdays with Timeless. I'm Dr. Stephanie Christian. This month we've talked about the treatment of various vascular conditions. 2 weeks ago we talked about the treatment of visible vessels on the face, and last week I talked about treating leg veins. Today I'm going to talk about the treatment of diffuse redness on the face, but I'm going to specifically talk about the treatment of vascular diffuse redness. So what is this? It's caused by dilated vessels deep in the skin. They're dilated permanently, and so they cause a ruddiness, which is what we call it in men, and rosy cheeks, which is what we call it in women. But they are not close enough to the surface yet that we can see distinct vessels. It's just a diffuse redness. We need to distinguish this from things that cause redness in the skin that aren't vascular. For instance, seborrheic dermatitis, which is a rash on the face that can appear either oily or dry and scaly, or psoriasis, which is when the skin has an acceleration of its production of new cells and they stack one on top of each other. And it looks like patches of raised red scaly cells. Or eczema, which is also known as atopic dermatitis. And if this shows up in an infant, it shows up on the cheeks, and it's very itchy and red and scaly as well. So these are conditions where you can have a lot of redness, but they can also be transient, meaning that they can be managed and they can come and go. The one I'm going to talk about specifically today is the diffuse redness that is permanent and vascular and goes along with rosacea. It usually starts with someone who blushes easily, and then as it progresses, they flush easily in response to things other than just emotional stress, but certain foods or environmental triggers or lifestyle triggers. And then that flushing becomes permanent, and they have a redness here in the center part of their face. And if it progresses from there, then they actually do develop discrete, distinct vessels on their cheeks, on the sides of their nose, then on their chin. So how do we treat this diffuse redness? Well, the first thing we have to do is diagnose it, because you need to know what you're actually dealing with it. And next, we need to identify what the triggers are. I did a whole video about rosacea, so if you think you might have rosacea, it would be worth your while to listen to that whole video so that you can really get soup to nuts about rosacea, not just the diffuse redness that I'm going to be talking about now. So the triggers can be so very many things. 80% of people that have rosacea have sun as a trigger. A different 80% have stress as a trigger. A lot of people have heat as a trigger, and that can be, the heat outside or inside heat, or a hot beverage or a hot shower or exercise. Some people have different types of food as triggers, so acidic foods or marinated foods. Some people have alcohol as a trigger. In fact, a lot of people have alcohol as a trigger. And we're not exactly sure what it is, because it's not just wine or red wine. It can also be beer. It can also be hard liquor. For some people it's cold or it's wind. For some people it's products, and products that have alcohol or witch hazel, or products that have peppermint or eucalyptus or menthol or clove oil or citrus in them. In general, people who have rosacea say that occasionally to frequently their skin tingles or burns or stings, and this can be exacerbated by the products they use. Those ingredients that I listed are some of the worst offenders, but there are other offenders as well. And there are certain medications that can make rosacea worse. Calcium channel blockers, which are a type of blood pressure medication. Vitamin B related medications like niacin and nicotinic acid and nitrates. So there really are there is a long list of possible triggers. It's really important, if you think you have rosacea or you've recently been diagnosed as having rosacea, to sit down and with a thorough list and identify each of the triggers. I can guarantee you have sun as a trigger, and I can guarantee you have stress as a trigger. Then go through the rest of the list and see what other things on there ever make you flush, ever make you blush, ever make your skin tingle or sting or burn. What do you do about it? Well, first, you always wear a sunscreen, and it should be a zinc-based sunscreen, and it should be every day of every week of every month of every year, whether or not you see the sun outside and whether or not you're outside. We know that it's the UVA rays that are the worst actors, and they penetrate ozone clouds and glass. And so you can be inside, in your car, in your home, at work, and those rays can penetrate and get to you. We also know that you can get UVA rays from fluorescent bulbs. So you might be working in retail, or you might be working in an office building, or in a school, or at a university, or in a doctor's office, or in a hospital, and you could be getting the UVA rays even though you're nowhere near a window. So it's important to wear a good zinc-based sunscreen every day. Next, stress management. We all have stress, some have more, and you can't eliminate stress, but how you manage the stress is really important, because that pressure inside the blood vessel that happens when our blood pressure goes up is what triggers the neovascularization. Neo means new, vascularization means making new blood vessels. And that neovascularization is one of the hallmarks of rosacea. So when you have that increased pressure inside your blood vessels and you're making new blood vessels, that is one of the things that makes rosacea worse. So you have to, in the heat of the moment, in the heat of the stress, be able to do something that will bring down your blood pressure and bring down your pulse. And one of the things that studies have found to be most effective is breathing exercises. You can do it right then and there. You can do it when you have, a micromanaging boss, or you have a difficult customer, a difficult client, or, the isolation of a pandemic is getting to you, or financial stress is getting to you. Right then and there, you can do breathing exercises, and studies have shown that they will bring down your blood pressure and they will bring down your pulse. And that's what someone with rosacea needs, because you need to decrease that pressure inside the vessels so that you don't have the neovascularization happen, so that you have new vessels that are going to end up dilating and causing more of that diffuse redness. Then you have to go to your triggers. Now that you've identified your triggers, you need to figure out how you're going to mitigate your exposure to those triggers. It doesn't mean living a monastic lifestyle. It doesn't necessarily mean cutting out all alcohol. So maybe you and your spouse are people who travel for wine. It may not mean that you have to cut out all wine. Experiment. Maybe you'll find that you only have to cut out reds. Maybe you'll find out that you only have to cut out certain reds. Play with it. Identify which ones actually cause you to flush and blush. Be careful about products. There are a lot of products that will cause inflammation in the skin. We know this is an inflammatory process. So eating an anti-inflammatory diet and using products that don't cause inflammation in the skin is beneficial. Unfortunately, a lot of the prescriptions for rosacea are really best for type 2 rosacea, which is the pustular rosacea, and they really don't help with type 1 rosacea, which is the vascular kind, the kind that has the flushing and the blushing and the diffuse redness. In fact, certain prescriptions can make it worse, can make the stinging and the redness and the burning worse. So I usually don't prescribe those at all. What we have to do is we have to identify the triggers. We have to stay away from those triggers. We have to use the right products. We have to eat an anti-inflammatory diet. We have to wear a sunscreen. And if you're doing all of those and you're doing them consistently and you've still got redness, then it's time to go to laser genesis. Laser genesis is a 1064 ND YAG laser, and it's targeting the dermis, which is the layer of skin under the layer that you can see. And it shrinks those vessels that are causing the diffuse redness. So those vessels that have gotten dilated. And it takes care of that diffuse redness. It's not a cure though. If you continue to expose yourself to your triggers that cause the flushing and cause the neovascularization so that you're making new vessels, we are in a push me, pull you situation where I'm chasing a train downhill. We have to be a therapeutic partnership where you're doing your part and I'm doing my part, because ideally I would like to be able to treat this diffuse redness and then have you not develop more diffuse redness and have you not develop those discrete vessels. That's the thing that I'd really like to accomplish, because I think knowledge is power. If together we can educate you to the point that you can take control of this, identify those things that make you worse so that you can stay away from those things, and we can treat your skin so that you can go back to less inflamed skin, you can be using products that keep it less inflamed, then you may not progress at all, but you have to do your part. If I use the laser and make it less red and you decide, great, I'm back to red wine, and great, I don't have to wear sunscreen anymore, then all of that work is undone and we'll be right back to the beginning. This is not a disease that gets cured because we're not changing your DNA. This is something that's ongoing. This is long-term management. So, what does laser genesis feel like? Well, I'm a freeze baby, and so to me, it's warm and it's therapeutic. It's like I'm spraying you with heat, and your skin feels sort of youthfully tight, and you have a glow to it. Men who have beards, I give them the option of staying away from the area that has the beard, or if they want me to treat that area, they have to shave it that day, because the pigment in the hair is also going to attract the energy from the laser. So they're going to feel a real sting on every one of those hairs. How many treatments do you need? Well, it's gradual and it's cumulative. In general, I'll say that it takes about 5 treatments on average to treat diffuse redness, but everyone's different. So I hope that this has helped and it's answered any questions you have about the management of the diffuse redness that is vascular in origin and that is associated with rosacea. If you have any questions or comments, please comment below. And I look forward to talking to you again next week.